A very pleasant morning, everyone. I'm Naga Nandhini of second year BDS from Sri Balaji Dental College and Hospital, Chennai. Today I'm here to present on the topic trench mouth. We all must have heard of gingivitis and oral cavities more often. But have you ever heard of trench mouth? So basically, what is a trench mouth? It is a quickly progressing infection of the gums marked by bleeding, swelling, pain, and ulcers between the teeth and dead to gum tissue. Trench mouth is also known as Vincent stomatitis or necrotizing ulcerative gingivitis or acute necrotizing ulcerative gingivitis. Tracing back to the history of trench mouth. Although it was documented as early as 4th century BC, the term trench mouth came into experience only after World War I. Because during World War I, more often the soldiers were stationed in the trenches, where they severely got infected due to scarcity of dental supplies, stress, poor diet, and poor hygiene. These are some of the pictures of now and then pictures of trenches. Moving on to the prevalence. This disease is very uncommon, rare, and serious condition with a prevalence of less than 1%. It is commonly seen in teenagers, young adults, that is between the age group of 15 and 35 years, in armed forces, in poor living conditions, or poor nutrition. So causes. What are the causes for trench mouth? Mainly, it is caused by anaerobic gram-negative bacteria, particularly Fusobacteria and Spirochete species, or by poor oral hygiene, poor nutrition, smoking, weak immune system, stress, HIV infection. This HIV infection directly affects the immune system of an individual. This makes the individual more susceptible to all kinds of infections like trench mouth. Diabetes, gingivitis, or other oral infections, when it is untreated for a very long time, it progresses to trench mouth. And alcohol abuse, this also causes trench mouth. Moving on to the clinical manifestations. So what are the symptoms which will appear because of trench mouth? Severe gum pain, bleeding gums, red or swollen gums, then pain while eating or swallowing, gray film on the gums, ulcers between the gum and teeth, foul taste in the mouth, halitosis, that is bad breath, fever, tired, and restlessness, then swollen lymph nodes around head, neck, or jaw. Diagnosis. So how to diagnose the trench mouth? Medical history, including diet and overall health habits, and by taking medical consultation if the patient has an impaired immune system. Taking dental history, focusing mainly on the pain symptoms. Then by detecting certain kinds of bacteria which are especially known to cause the trench mouth, like fusiform bacteria, Prevotella intermedia, and spirochetes. But still, only their presence is not enough to diagnose the trench mouth, because these kind of bacteria are also present in the mouth of people without the disease. Or by gentle prod in the gums to see how easily they bleed when poked. Some doctors can take x-rays to see whether the infection has spread to the bone beneath the gums. Then the doctor may check for the symptoms, other symptoms like fever, fatigue, swollen lymph glands in the head and neck area, ulcers between the teeth and gums, then inflamed gums, gray film in the mouth, or pasty saliva. The doctor might also draw your blood to check for other possibly undiagnosed conditions like HIV infection, diabetes, or other immune problems. Moving on to a very important aspect, that is treatment. How to treat the trench mouth? This treatment involves 4 stages. First stage mainly focuses how to stop the progression of the disease and control feeling of discomfort and pain by debridement, that is removal of dead tissue from affected areas using an ultrasonic instrument or chemical agents, and use of antibiotics, oral antibiotics, if the patient has a weak immune system, fever, or swollen glands, and use of painkillers. Second stage focuses on treating pre-existing conditions such as gingivitis by cleaning of the teeth and gums, scaling or root planning of the teeth, and instructing the patient on dental hygiene practices, good nutrition, and appropriate fluid intake, and prescribing antibacterial mouthwash twice daily. Third stage includes surgical procedures, that is, gum surgery to fill in the craters. Fourth stage includes maintenance and support, that is, long-term monitoring to ensure that good oral hygiene practices are continued and that the patient has control over the factors that cause the disease in the first place. So there's a very famous quote known as prevention is better than cure. Prophylaxis. So let's see some prophylaxis, that is some preventive measures. Regular brushing and flossing of the teeth, avoid cigarettes and tobacco products, proper diet, proper nutritious diet, then reducing the stress, and having regular dental checkups. These small preventive measures will keep us away from trench mouth and helps us to lead a very happy and healthy life. Thank you.